Good morning, everyone, or good for the morning if you're in Australia, like our presenter is. I want to welcome you to our second webinar, the second of four in a series for our Men's Health Month webinar campaign. This month we are celebrating what we call our warriors, as Native men are all often called. And our campaign is entitled Let's Hear It for the Warriors. So today our webinar topic is listening to the voices of young Indigenous males about their health and well-being. And the subtitle is Lessons from the Northern Territory, Australia. We are extremely happy and grateful to have Professor James Smith with us as our presenter today. Before I introduce Professor Smith, I just want to give a little bit of background and express gratitude for this grant. This grant is the Making Connections for Mental Health and Well-Being Among Men and Boys in the US. It is funded by the Movember Foundation, which is the leading charity that focuses on male health. It is coordinated by Prevention Institute in Oakland, California. And we are in year 5 of 5 years of funding, and we're really grateful for Movember and the Prevention Institute allowing us to be one of 16 sites across the US who has received this funding. So because of this funding, we've been able to do a lot of things at Southern Plains Tribal Health Board Tribal Epidemiology Center. We've been able to host a men's health track or our annual tribal public health conference. We've been able to plan activities like these for Men's Health Month, and we've been able to do a lot. So we are really happy for that. Obviously, as a tribal servant organization, our focus is American Indian men and boys. And our unique program is titled Empowering American Indian Men and Boys to be Healthy in Mind, Body, and Spirit. So I'm going to go ahead and introduce Professor Smith. Professor Smith, James Smith, is the Father Frank Flynn Fellow, Harm Minimisation at Menzies School of Health Research in Australia, and is currently a Visiting Fulbright Senior Scholar at the Curtis Center for Health Equity Research and Training at the University of Michigan. At least he was. He's now back in Australia. He has worked in the field of Indigenous health and education research and policy context for the past 12 years and has a particular research interest in the health of boys and young men of color. He also has long-standing interests in advancing health promotion and men's health at local, national, and global levels. So welcome, Professor Smith. Is actually just after 1 a.m. in the morning in Australia. When we had planned this webinar, we were in discussion. Professor Smith was supposed to be in the US for at least another 2 weeks, but because of the constantly changing nature of everything going on around the COVID-19 coronavirus, he was asked, he had to get one of the flights that was available back to Australia, and it meant that he had to move his time up. So he gratefully and graciously is getting up at 1 o'clock in the morning to actually do this presentation for us. So we're really grateful, and we know that we will benefit from what he has to share with us about working with Aboriginal young men in Australia. Before he gets started, I want to just give you a little update or overview of how we will do it. He will present, and then we will give the rest of the time for discussion, at which time then I can unmute you or you can unmute yourself. Sometimes it's hard to keep track of all the questions coming in the chat. He doesn't plan to do a long presentation. because he really wants it to be interactive, and he wants to learn about the experience with Native American men and boys here in the US. So he wants it to be not just learning from him, but he wants to learn from us as well. So it will be very interactive. So if you will hold your questions, write them down, and at the end of the presentation, feel free to ask questions because there will be a lot of time for that. I will turn it over to Professor Smith. Welcome, and thank you for joining us.
Thanks very much, Susan. I will just get my screen up. What's happening there? Sorry, I'm just grabbing. There we go. Okay, hopefully everybody can see the screen, my presentation. Excellent. So thanks very much for the introduction, Susan, and apologies if it's a bit dark in the background. Apologies if I'm speaking a bit softer than usual. As Susan mentioned, I'm currently stuck in quarantine back in Australia. It is 1 a.m. So I'm a little bit jet lagged, a little bit tired, but I'm really keen and feel very humbled to have been invited to present during Men's Health Month on this topic. There's a few things that I wanted to start off with before I do launch into the presentation. One is that I am non-Indigenous, and I recognise as a white male that I hold power and privilege. And I think that it's really important that I acknowledge that at the moment, with some of the stuff that we've been seeing happening in the US and globally as well, back home here in Australia as well, I think it's really important that we recognise that there's structural and systemic racism that many Black, Indigenous, people of colour have faced and continue to face. And I'm hoping that the research that I share today can go a small way in opening those conversations and having a bit of a strengths-based discussion around how we can best support Indigenous males, not just in Australia, but globally. Before I go on, I would also like to acknowledge and pay respect to the 44 federally recognised tribes served by the Southern Plains Tribal Health Board, and I'd also like to acknowledge and pay my respects to elders past, present, and emerging back home in the Northern Territory for where the research that I'll be sharing today has taken place as well. As a little bit of background in terms of what I'll be presenting, I'll talk very briefly around what do we know about men's health, what do we know about Indigenous male health, and then I'll launch into some discussion around a project that we ran around understanding health literacy among young Aboriginal and Torres Strait Islander males in the top end of the Northern Territory. And I'll provide some context as we go through around the geography and nature of that particular project. I'll talk about some of the key learnings, and then, as Susan mentioned, I really want to open this up to a discussion where we can talk about the synergies and differences between the Aboriginal and Torres Strait Islander male health context in Australia and that of American Indian males in the US. So what do we know about men's health? Well, as I mentioned right at the start, men have more power and privilege than women, and that's something that's global across all industrialised countries. But we also know that men have shorter life expectancy and they have higher premature mortality than women. So essentially they have poorer health outcomes and they also die earlier. But we also know that they tend to adopt risky health practices, but it's important that we understand that that's not necessarily their fault, that it's the environments in which they live that can perpetuate those risky health practices. Same thing goes for men being perceived as reluctant healthcare users or reluctant to seek help. We also know that there's a whole range of factors that influence that, whether that be gender, whether that be cultural, whether that be some of the socio-political contexts in which they live. But what we do know with all of those things is they're disproportionately noted among marginalised adolescent boys and young men, and particularly Indigenous males. And that's sort of what I'll be talking about today. So what do we know about Indigenous male health? We know that they face significant challenges with help seeking and health service use. And again, when I'm not pitching blame at them as individuals, we've got to understand that within the context of the social and environmental factors that they face. So there's a range of things that prevent them from being able to access health services, and some of the great work that Susan has been doing locally through Making Connections, as are the other Making Connections sites around the US, are trying to break down some of those barriers. We know that they have poor mental health and high rates of suicide and suicidality. Again, not their fault. There are a whole range of reasons for that as well. What we've got to focus on is how can we support their well-being and improve their health outcomes in that regard. And similarly with social determinants of health, whether it be education, and whether we're talking around any level of the education system, primary, secondary, college and university. If we're looking at the participation, achievement, completion, that's poorer than that of females. We know that they have high levels of disengagement and suspension, and we know that there's low levels of post-secondary education and career aspiration. So it's a grim picture. We also know that there's high rates of incarceration, challenges associated with accessing and retaining safe and secure housing, overrepresentation in the child welfare system, which has lifelong repercussions, poor job attainment and retention, and high rates of unemployment. Now, I know that what I'm talking about sounds very negative, but what we know, as I mentioned already, is that it's the social and environmental contexts that often shape these health patterns and impacts these social determinants of health. And one of those that crosses across all of those is the experience of intergenerational trauma. And we need to be aware of that. We need to make sure that there are healing practices in place to be able to support Indigenous males. But I also want to honour the strengths of Indigenous males. Susan mentioned at the beginning that the theme of the webinars for Men's Health Month is that of the warrior, and I think that's really salient for today's presentation. We know that Indigenous males are strong, resilient, courageous. We know that they can bounce back in tough times. We know that they've got amazing skills and depth of experience from their culture to draw on. We know that they're exceptional community leaders and role models. We know that they're great fathers, partners, uncles, grandfathers, sons and nephews. And we know, and I think this is a really important thing within the context of Indigenous males, that they're nurtured by and through their cultural identity. That's a really strong and important part. Something that I do want to acknowledge is that our warriors back home, in Aboriginal and Torres Strait Islander males, have really led a charge in terms of what's happened for Aboriginal and Torres Strait Islander male health in Australia. Back in 2004, a national framework for improving the health and wellbeing of Aboriginal and Torres Strait Islander males was developed by a group of leading men's health scholars and experts from across Australia, and it was really developed from the community up. It was done from a place of self-determination, and I take my hat off to the people involved in developing that framework that's guided some of the policy development since. That particular framework became instituted as part of the National Male Health policy back in 2010. And on top of that, we've had the National Aboriginal Community Control Health Organisation develop the Aboriginal Healthy Futures Blueprint from 2013 to 2030. So that's got a long trajectory to it. And as you'll see there, it's focused around things like social and cultural determinants of health, respect for elders, culture and traditions, responsibility. So they've mapped out their own pathway and the things that are important to them as part of their health and wellbeing. And you'll see some of those things that I mentioned before as being important to that. What I wanted to talk about today was this particular project. It was a project around health literacy among young Aboriginal and Torres Strait Islander males in the top end of the Northern Territory. And the project aim was really around looking at the intersection between gender and cultural identity as it relates to age and as it relates to health and wellbeing. So that's what I'll be talking about. In terms of understanding the geographical context where this work took place, you'll see the map of Australia down the bottom there, the small map. The Northern Territory is the highlighted blue space in the middle and top part of Australia. So just to get your bearings, you'll see that the larger map is of the Northern Territory, and this particular research took place in Darwin, Palmerston, Katherine and Nhulunbuy. So those top 4 communities that you can see listed there. To provide some more context, it takes about 2 hours, a 2-hour plane flight to get from Darwin to Alice Springs to the bottom there. So it's quite a large geographical space. But it's a small population for that large geographical space. It's 235,000 people that are spread across that large space. 30% of those are Indigenous or Aboriginal and Torres Strait Islander, and very geographically dispersed. So there's multiple regional, remote and very remote communities. So we're talking communities of anywhere less than 100 right through to about 5,000. And then those ones up the centre there, Alice Springs, Tennant and Katherine, are slightly larger regional centres. And then Darwin, Palmerston is a hub of about 120, 125,000 people. Northern Territory is unique in that it's got both a tropical and desert climate. So tropical up the top, in the top end where this work took place, but desert country down in central Australia near Alice Springs. We know that Indigenous health and social outcomes are extremely poor for the Northern Territory population, but we also know that that the Indigenous folk have a particularly strong connection to culture and have a strong tradition of Aboriginal community control and self-determination. To provide more context of the Northern Territory, we've got the map of Australia there overlaid across the top of the United States to provide some context, and then Northern Territory is mapped over the top of Alaska there again to provide some context. In terms of the research team, this was a truly collaborative project between Indigenous and non-Indigenous researchers. And to provide some context, this was a really large team for what was actually quite a small project. But I think that large team meant that that there was a certain richness to this project. It's certainly one of the most exciting projects that I've been involved with. So just to introduce you to pay respect to the people that were involved, we've got Dr. Uncle Mick Adams on the top left-hand side there, and moving across Jason Bonson, Barry Judd, Jesse Flay, and David Adamson. They all identify as Aboriginal and or Torres Strait Islander males, and we've got Richard Osborne, Murray Drummond, Anthony Molino, Ben Christie, and myself down the bottom. We're all non-Indigenous. But between that team, we've got expertise in Indigenous male health, men's health more broadly, masculinities, health literacy, and Indigenous health and health service utilisation. So a whole mix of skills and expertise there that's been brought to the table with this project, which has been important given that we've been looking at those intersections between culture, age, and gender. So what did we do? Well, the population group that we were looking at was young Aboriginal males aged 14 to 25 years of age. We engaged them in yarning sessions, and that included 9 yarning sessions over 3 regions, Katherine, Darwin and Nhulunbuy. For those who aren't familiar with yarning, but I suspect many of you are, it's a relatively informal, sort of open-ended storytelling process where it's far less structured than a focus group or an individual interview. We had lots of organisational support in terms of conducting those yarning sessions. We engaged in Flexible Learning and Education Centre, so they were young Indigenous males that were at risk of dropping out of school, some that were involved in a sporting academy, some that were involved in an alcohol rehabilitation program, some that were involved in an employment program, and some in a youth program. So from different backgrounds, and I think that's really important that we've got lots of diversity in terms of the group that we engaged. We also did a social media analysis, and that was a really exciting part. The original concept was to do what they call photo voice, which is where we ask those young men to take photos or images of things that are important to them, and then to come back and discuss why they took those photos. We decided to veer away from that because we noticed that a lot of these young men already had iPhones and were engaging in social media. So we instead asked them for individual informed consent during the yarning sessions to be able to access their Facebook pages retrospectively. So content that they'd already posted. And I'll be talking about that, and you'll see some of those images as we go through. So there were 5 overarching themes that were mentioned by these young men. One was Western concepts of health. So they defined health in terms of, from a Western perspective, particularly in terms of physical and mental health. But they also spoke about cultural concepts of health. So it meant that they're navigating a sort of an uneasy nexus, if you like, between those two things. They spoke a lot about social determinants of health, about the impacts of employment, education, housing, incarceration on their lives. They also spoke about family, and they spoke about friends and their mates. And I'll talk about each of those themes as we go through. As I mentioned before, the photos that are presented here are all photos from their Facebook pages. And what I'm hoping that we can convey through this data is that it's a different narrative. It's a strengths-based narrative. It's celebrating their life and achievements and what the good things in life that they're doing, what's important to them. And you'll see lots of depictions about activities on country. So that includes things like hunting and fishing, just being on country generally, as you'll see depicted in some of those photos. So please think about those images as I'm talking about the themes. So the first theme around Western concepts of health, as I mentioned, it was sort of divided into physical and mental health. The physical health aspect probably isn't a surprise. It's those things that we hear a lot, that we see a lot of health promotion and behaviour change work happening in, whether it be around physical activity and sport, alcohol and other drugs harm minimisation work, whether it be about sexual health, about reducing road trauma, stopping smoking, preventing violence, etc., etc. But we also had quite a deep narrative around mental health, and it was sort of split into 2 categories, if you like. There were some of the more, clinical notions or traditional notions of mental health, where there was discussion around depression and anxiety, discussion around hopelessness or boredom. But there was also this counter narrative, a much more positive narrative around the importance of achievement and aspirations, the importance of relationships, importance of role models and social support, being recognised and hearing praise. So it was really, and we didn't do this as a comparative study, so we don't know whether this is the same as non-Indigenous males or not. But I think what's interesting there is that there is a very sharp focus on mental health and wellbeing, and that means that there's an appetite to be engaging in discussions in this space, which is contrary to what the scholarship would generally tell us. A few more images there. Guy on the right-hand side there, engaging in a campaign which is looking at suicide and raising awareness around mental health, etc. And I've got a few quotes from the yarning sessions, and I'll share at least one of those for each theme as I go through. So as one guy says here, dudes are meant to be tough as nails, not give a shit about anything, and girls are sensitive. You're always told to harden up when you cry, from fatherly figures, like your dad or your pop. He'd always tell you to man up or something like that. So whilst there was these expressions of what we call hegemonic or traditional masculinity, which are perceived to be health damaging in many instances, what you'll see in some of the later discussion and images is that there was a counter to that. There was also discussion around emotions, about love and respect for family and father figures and mothers as well. So you'll find that these young men are balancing a really tricky divide in terms of their identity, who they are, and what that looks like. Now, in terms of cultural concepts of health, as I mentioned before, there were things like being on country, fishing and hunting that were mentioned regularly by nearly all of the young men in this study. There were also some terms that have a specific cultural connotation that are very difficult to explain within English terms. So I'm not going to do that, but terms like staying strong, doing things right way, and discipline are three of those terms. Staying strong doesn't mean strength as in physical strength. Doing things right way doesn't mean that there's a right or wrong way. It means more that there's a cultural connection to the way that you do things. And discipline, again, it's not discipline from a physical perspective. It's much more embedded within sort of a social and spiritual understanding of health. On top of that, they also spoke about bush foods, bush medicine, and their cultural identity. Some men, but not many, spoke about intergenerational trauma. Many of them did speak around the respect for elders, but they also shared that they found it hard that they didn't feel that some of the people, some of the men that they need to look up to were supporting them in the way that they could. And we found in other research that some of the elders, some of those older men are finding it difficult to connect to the young males as well. So there's a real need for some intergenerational exchange in that regard, and a real openness from both elders and younger men around engaging in intergenerational exchange in that way. In the Facebook data, but not in the yarning session data, there were these notions of sovereignty that came up as well, and that was most frequently depicted through images of the Aboriginal flag, which is shown there. Here are some more images to reinforce those notions of being on country, hunting, fishing, and sovereignty. And to share one of the quotes, bringing them up right way. Nowadays, culture is pretty important to have them around. I think it's important to watch them grow positive. I've seen it growing up with a couple of my cousins. They went downhill, but then their parents have to, pull their heads in off the rails. They grow up quickly, but for your own thing, I reckon it's the right way to bring them up. And you'll see these images there again of hunting, and often those images of hunting were with family members as well. So there was notions of mentoring and care and respect being shown among these young Indigenous males. The third theme is that of social determinants of health, and as I mentioned before, and right at the beginning, we know that those social determinants impact on the lives of these young men in different ways, and that certainly was reinforced through what they discussed in this research project. They spoke about unemployment, jobs and careers. They spoke about school and education, around detention, jail, incarceration, and unfortunately for many of the young men, particularly those from very remote areas of the Northern Territory, incarceration was seen as something normal. It was seen as something that many of their brothers or fathers had experienced, and something that they expected to experience within their lifetimes. That needs to change. We've heard similar, certainly we've heard very similar stories in the US of late as well. So we really need to take action to start reducing those systemic and structural barriers when it comes to jail and incarceration in the justice system more generally. They also spoke about housing and accommodation. They spoke about racism. And importantly, they also spoke about community and civic participation, particularly those that were aligned to a sporting club or some sort of organised club. The other thing that we noticed with the discussion around social determinants of health was that these were discussed more frequently with those young men that were either becoming fathers or had recently become fathers. As I mentioned before, the age group was 14 to 25, and we somewhat naively went in as a research team thinking that they wouldn't have children of their own. And of course, what we find in this population is that they are fathers, that they are known to have children at a much younger age than the broader population. So many of them young men we interviewed that were 18, 19, 20 already had children. So these things were really important to them, and they expressed the importance of these things in terms of caring for their children as well. And again, that came across in some of the imagery, which we'll see shortly as well. As one participant said, be a ranger, a tour guide. Nitmuluk is pretty big. I'm from Kakadu. My mum's from there, and most of my family and rangers are from there. My older cousin was a ranger, and he got good jobs, good money from there, and he told me it's fun. Takes people on boat tours to different waterholes and all that. That's what I want to do. So here he was reflecting on an employment opportunity that was specific to his community context. It was around essentially Indigenous tourism within his region, about sharing information around his culture to tourists that frequent the region to come and have a look at the country. So he'd identified that there was a job, that there was good pay, etc. Our family, some of the pictures that we found on Facebook were amazing in terms of the way these young men expressed the love for their family. That extended to parents, grandparents, brothers, sisters, aunties, uncles, and it was expressed through love and respect. There was also another narrative around fatherhood and parenting that was quite strong as well. And again, you'll see some of those images in a moment as well. So as one young man mentioned, mum, dad and siblings, families are really important. They are our personal connections. If I'm feeling sad or something, my dad mostly, because I tell him everything that happens. He helped me eat my vegetables. He'll say, stop being lazy, get up and do something, get some exercise, go for a walk or go fishing. So this notion of others supporting them in terms of their health and well-being and the importance of family in that regard. And as you can see there from the images, this notion of fatherhood or parenting is something that they aspire to, and sometimes that's reflected quite comically within their Facebook posts. But you'll also see things around dads can take kids to school as well. Now, these are young Indigenous fellows that are posting this stuff on their web pages, so it's really important that we understand that these are expressions that they're sharing with their peers, and they're certainly not things that I was expecting to see when we undertook this research. And the last theme is that around friends and their mates. So you'll see we saw lots of images like this one here around having a good day out with these blokes and talking about the importance of their friends and mates. They spoke of them as being their confidants, particularly people that they go to for help seeking before they go to seek professional help from a health service. They spoke about these mates being their trusted friends, that there was that notion of trust in what they did and didn't discuss. But they also spoke about risk-taking around fun and humour and the things, the mischief, I guess, that they get up to with their mates as well, and that being an important part of their life. They spoke about mates and friends in terms of sports as well, and how important those structured activities were to their health and well-being broadly. And then they spoke about friendship. And here's a few other images, lots of images around sporting teams or going out on trips with mates there as well. Some images as well about, I guess, contemplative aspects of their relationships as well, that sometimes things don't go smooth sailing as well, and that was reflected in a variety of different ways. And as one young man commented, school, I just come to school to try to get myself a job, a license, and to see my friends. I come to school to see my friends. Most positive ways, some negative. Sometimes you're stressed out, mad, angry. You just need to go check your friends out and calm down. So this notion of being able to support each other on a peer-to-peer basis, which gives us some information around what is likely to work within a health promotion context with these young men, that actually peer-to-peer programs is probably a good way to go, and or programs with a family orientation. So what are some of the key learnings from this research? Well, we know that young Indigenous Australian males conceptualise and negotiate health from both Western and cultural paradigm. They're at this tricky interface where they're trying to navigate both these cultural aspects of their lives, but also these Western aspects of their lives as well. But by and large, they do that exceptionally well. They don't have a lot of guidance about how to do this, but it does pose tricky situations for them. We also know that they both resist and embrace masculine gender norms. Now, there's a lot of scholarship at the moment talking about challenging masculine norms, challenging those norms that are considered to be health damaging, particularly those that are aligned to toxic masculinity. But what's really interesting from this research is this resist and embrace, in that they're able to do both. And that's something that we can learn from and build into some of the health promotion work that goes on with these young men. We also found that there's strong alignment with concepts of Indigenous masculinities, and particularly two aspects there. Connection to country is something that was discussed a lot as being important to them, their masculine and cultural identity, and also this notion of intergenerational exchange of information, this notion of learning from and respecting elders. Some other key learnings, we recognise that there's key milestones in these young men's life, but that we need to celebrate those really well. And this is really important to counter what is often a very negative popular media and social media presence in the way these young men are depicted. So it offers, I guess, different strengths-based narrative that can be used in school, that can be used in social media context. And it's really important that we think about and celebrate the good things that are happening in these young men's lives. We also know that family and friends are critical in the way that they talk about their health and well-being. And as I mentioned before, this indicates that family and peer processes should be used in terms of health promotion programs and services that are offered to this group. At the moment, certainly within the Australian context, a lot is still individually focused. So it's still individually focused behaviour change work that's happening. There's less work that's happening in that peer-to-peer and or family context. In terms of social determinants of health, as I mentioned before, we know that as they're entering young adulthood, particularly as they become fathers, notions of social determinants of health becomes increasingly important. So we need to be thinking about those when they're younger, not when they're adults. We need to be thinking around how can we set them up to have the best education they can, to have pathways into employment, to make sure that they've got access to secure housing, to make sure that we've done everything in our power to prevent incarceration. And I think this is the last slide around key learnings. One is that they reinforced throughout this research that they really preferred settings-based approaches, meeting them where they are. Don't expect them to go into a health service. So whether that be at a school, whether that be at a sporting club, whether that be at some other organised activity, whether it be an activity on country, those things are important. And similarly, outreach activities were really important to them. So activities that were on country, such as hunting, fishing, camping and treks, were important. And we have seen an increase in those within the Australian context, particularly to engage young men at risk. So it's been used in a few diversion programs that have been developed in Australia. But I guess what we haven't tapped into as much, but that is important, is that these types of activities are really important for promoting social and emotional well-being. From a research perspective, we found that working in partnership with organisations that already engage these young men was really important. And we think that that's a critical mechanism to continue work in this area. And in terms of social media, we found that an extremely useful way to understand the health needs of these young Indigenous males. We were able to unpack things that we didn't hear in the yarning sessions. The way that we went about it, by retrospectively looking at the Facebook posts, meant that we hadn't gone to them and said, you tell us about your health and well-being. It meant that we were looking at more authentic representations of how they'd already posted those images. So all of the content that we've shown here today is stuff that was done retrospectively, that we've looked at retrospectively. It was posted before we started this research project. So it wasn't done deliberately for us for research purposes. It was stuff that was already there, and we need to make better use of that content to understand the lives of these young fellas. That's all that I wanted to share today, and I really want to open it up for questions from all of those online to hear about how you think this is either resonates with or is different from American Indian boys and young men within the US. So I'll stop it there, and really keen to hear from some questions. So thank you.
Thank you so much, James. That is fascinating research and fascinating findings and lesson learned. I have two, a comment and a question in the chat. So we will start with those. I see Mr. Barton, who is our executive director. By the way, he's on the webinar as well. He has raised his hand. So Mr. Barton, I'll come to you. Let me just first address these questions that had come in. The first one says, it's an important distinction between Western and cultural health concepts. In both, there seems to be a strong male peer influence, which I see. It's when a peer gets sick or injured that it's a good time to talk about health or preventative treatments, or even getting health insurance. How to get young male attention to health treatment before a friend gets hurt in a motorcycle accident or passes out from diabetes reactions or suicides at school. Thanks.
Completely agree with that. Any health promotion and prevention activity that engages these young men before they're at risk, whether that be in terms of their physical health, their mental health, their social emotional well-being, is really important. And I guess what we've pointed towards, or what this research has pointed towards, is that linking family and peers into our thinking around that is really important. And whilst peers, in some respect, as I mentioned, may invoke notions of risk-taking and so forth, they're also really important in terms of being confidants, being people that these young fellas trust and turn to in times of need. So thinking about peer models of health promotion are really important. Thinking about family and the role that family plays. So when we're organising health promotion work, that we're not just thinking around young Indigenous men, that we recognise that those young men are connected, that they have a broader family and community fabric, if you like, that's important to bring into that story and discussion, to remind them that there's people around them that are important in terms of their health and well-being. What it means, though, is that we've also got to be brave. We've got to try new, innovative health promotion activities. We've got to think outside of the box. We've got to think from their perspective, not from a not from what we think's going to work, but we've really got to go to them and pay attention to their voices in the way that we structure those things. So I'm not sure if that's answered the question, but certainly I agree that the earlier prevention activities that we have, the better. And it's interesting, it's interesting to hear that that's really important within the US context as well.
The next question, what were the themes around the women in their lives?
Yeah, really good one. We've touched on that in the report quite a bit. So they spoke quite a lot around their mothers in particular, and how important their mothers were in supporting them as they grew up, the respect that they have for their mothers, and that their mothers are always a go-to person as well. In some instances, those young males that were in relationships also spoke about their partners, girlfriends or wives, and they spoke probably a bit more candidly, more so than what I anticipated, around the ups and downs of relationships as well, but that how important having a significant other is. Was also notions of parenting and motherhood also came through, perhaps not as strongly as fatherhood, but notions of having a supportive partner to raise a child also came through their work. So discussion around important females and their wives wasn't absent, but we've probably mentioned that more in the report than I have here today.
Okay, thank you. Mr. Burton, will you go ahead and unmute yourself and ask your question? And anyone else who wants to ask a question, feel free to raise your hand and I'll acknowledge you.
Yes, hello. Can you hear me?
Yeah.
Yeah.
All right, excellent. So, Professor Smith, this is Nick Barton, Executive Director here at Southern Plains Tribal Health Board. And, you know, given what's going on with the pandemic, we appreciate your flexibility in presenting this. And as far as I know, this is our first worldwide webinar that we've ever hosted, and quite exciting, and actually found a use for my iPad's world clock, and I see it's very much night in your time, and I really appreciate you accommodating our schedule here.
Not a problem.
And certainly thank you to Susan and team for presenting this webinar, and just really wanted to extend my appreciation to you. And you know, some of the activities that we're doing at Southern Plains Tribal Health Board, of course, it ranges from, I'd say, top to bottom: epidemiology, men's health, cancer information, diabetes, and one of our working in the areas of substance abuse prevention. We have what's called Partnerships for Success, and we've been really modeling culture is prevention in 4 very distinct tribes. And you know, one model doesn't necessarily work, but we found something that did work, and using the strength-based approach, instituting culture as prevention. You know, one way to get that is culture classes and aligning people at risk with elders or other role models in the community, and it's proven very successful for our 4 tribes. And so just wanted to share that, and you know, some of the similarities with the Aboriginals in Australia, or Native Americans in Oklahoma, and as well as through the United States. And again, certainly take the appreciation of you acknowledging what's going on here in the United States with regards to Black Lives Matter, Black liberation, and even our Native Lives Matter. So just a lot happening in the world, and I, again, appreciate you and thank you.
Listen, thank you very much for that feedback. And I think what's been really interesting around the 4 months that I had in the US undertaking a project around health promotion and health promotion that aims to reduce inequities among boys and young men of colour, something that's come out of that is that there are lots of similarities from a global perspective that like the one that you just mentioned then, in terms of that working with elders, that intergenerational exchange is really important. And I know some of the work that Lisa Wexler from the University of Michigan has been doing with Alaskan communities has shown, you know, has had a similar focus to it as well. So it's something that's really important. I think we're starting to see more specific programs and pockets of work being done, and the alcohol and other drugs space is one area where that seems to be happening, where there's a few, I guess, more culturally informed practices and services that are being developed as well, and where there's perhaps a few more pockets of innovation happening. So again, it's interesting to hear that as well. And I think as well, you know, I could, the Fulbright while I was in the US was for 4 months, and I saw it through to completion. Last Friday was meant to be my last day, and I was meant to be staying in the US for a couple of weeks afterwards and had to come back earlier. But I found it absolutely, what's the word? I had never expected that there would be such a sharp focus at the end of my Fulbright experience on notions of structural and systemic racism at a national and global level. And I think we've got to harness the protesting that's going on at the moment to actually change and have a really strong strengths-based narrative to put some pressure on some of the government officials and policymakers to say, actually, we need to invest in boys and young men of colour. We need to invest in, whether that be African American, whether that be Indigenous populations or other populations of colour. It's really important that we see investment, and some of the work that I've been privy to in talking to various stakeholders across the US. I've chatted to over 40 people in the last couple of months around the work that they're doing with boys and young men of colour. All of them said that there's not enough funding, that the funding is very competitive in this space, which is counterintuitive for collaborative processes. And there's very few examples of sustained national work in this space. I certainly acknowledge the work that the Movember Foundation has done in terms of investing in making connections, and that's been a 5-year investment. There's not very many examples like that. But again, it's important that those investments are sustained beyond 5 years. We know that for action around social determinants of health, and we know that that's important to their lives, we really know that we need to see longer term investments as well. I should also comment there that something else I found was that there's some not-for-profit organisations in the US that have been working in this space for nearly, some of them for nearly 2 decades. There is a lot of work going on in this space. And I take my hats off to those people that have been persistent, that have continued to invest, and that have worked closely with their communities from the ground up. And we need to be celebrating and documenting those examples so that we can learn. And I'm really excited to hear that this webinar is the first international reach out, and I'm hoping that this, awful pandemic experience in terms of COVID, as awful as it has been, is that we can learn and have new opportunities. And certainly one of those is we've all become much better at connecting via Zoom and online means. And I hope that that can continue, because we've got so much to learn to each other, not just at the local level, but nationally and internationally as well. And the men's health community has a lot to gain from that, as does the Indigenous health community as well.
Okay,
So thank you.
Thank you. I have several questions here or comments. Let me see, go to one that was waiting. Tamara, I see your raised hand, so I'll come to you next. An attendee said, that's a good point about young males both resisting and embracing male health ideals. Seems like a good way of describing the adolescent/young adult mindset of independence. How do you design health promotion messages that appeal to young adult sense of individuality and independence, but also the looking ahead in life health needs? Thanks.
Great. Yeah, great question. There's a few different, I guess, answers to that one from where I sit in terms of what I've learned from the work that I've been doing. I myself have been quite critical of embracing hegemonic masculinity in health promotion work. So there's a lot of, within the Australian context, we've had campaigns like Be a Man, that sort of reinforces notions of hegemonic masculinity. And while on the surface they might be useful for engaging some groups of men, they might not be useful for engaging some vulnerable or marginalised groups of men. We also know that it inadvertently perpetuates negative masculine stereotypes, and we probably need to steer away from doing that, even if it's inadvertent. And there's a few scholars in the US that have written similarly. I know Derek Griffith has written a paper around beyond masculinity, and Paul Fleming, I think, has written a paper as well that was in the American Journal of Public Health a few years back. But that being said, I think what this research has shown is that it's much more complex than just thinking around gender in a stereotypical way. We've got to work with those young men and try and unpack what that means for them. And there's no right or wrong way to this. I think it's about just acknowledging that it's tough for them, that they're trying to balance that, and that they do resist and embrace these aspects of their identity at any given time. And we've got to keep asking, you know, why are you doing that? How can we change that? How can we better support you? Rather than assuming that their actions are tied to an element of their identity, whether that be gender, whether that be their age, and so forth. So yes, we know that independence is really important. So what are some of the positive aspects of independence that we can promote? So I think that's an area where we've got to think differently, that we've got to look at new and innovative ways of engagement. So I guess the challenge is out there. Try new things, evaluate what you're doing. That's another thing that's come up in the conversations I've been having with people across the US, is that there's a lack of funding and or expertise to do good quality evaluation. But that's really important for building the evidence base around what works and what doesn't work. So as difficult as it is to do with the limited resources that we have, it's really important that we're monitoring and evaluating work with boys and young men of colour. And in fact, we're working on a book proposal at the moment to be able to build that evidence base where we can draw examples from practice around what's working, what's not, why not, and so forth. And you know, we're at the very beginning stages of that, but hopefully in a couple of years' time we will have a book with those examples, with examples like the work that's happening through Making Connections. And hopefully that can help guide us all from a practice perspective.
Okay, thank you for that. Tamara, would you unmute yourself and speak if you're able to?
Thank you. Sorry, testing. Susan, can you hear me?
Yes, we can hear you.
Okay, great. Yeah. I apologize. I wanted to first thank the presenter for sharing the information from the work that he's done. I think that is great. I actually have typed in a little bit of where I was going with my question, and one of the challenges and not challenges, one of the I think more recent thoughts that I've had, I actually have two nephews that have been incarcerated from a very young age, and both Native American. Their father, you know, had run-ins with the law from a very early age. I think that's just part of the tradition for many American Indian families. And when I talk to them, I always find it, you know, amazing that they just sort of got kicked out of the educational system early, and then they were put into this other system that didn't do anything to help them to improve upon that. But then they also get to this point where they just have no ability to express themselves. And I really wonder if activities like what you're doing, if that is a priority in trying to help these males be able to vent or allow the expression of whatever it is that makes them happy, upset. Southern Plains did a wonderful job a few years ago inviting Jeremy Fields, and he shared his experience working with Native youth on the Salt River Reservation. And I've always found it amazing that it seems like a main concept that he touches on is just really showing comparison models to show the youth this is you know, an example, and if you don't feel this, then that is, you know, basically a family unit looks like this. If you don't have that type of family unit, then you know, that you may be frustrated, or just trying to help them express things that clearly I'm not doing here. So I wonder if that's something that you had done with this group, and suggestions or lessons learned of how others might do that.
Yeah, we haven't done anything with this group specifically around that, although it's been very clear from doing this research that they're keen for action, that they're over the talk, and that they want to see action in this space. And we found exactly what you just mentioned, is that, you know, many of these young fellas had dropped out of education, or at risk of dropping out of education, that incarceration was normalised in a way that that I couldn't possibly have fathomed before I undertook the research. That was probably, as a researcher, one of the most clear take-home messages for me, is that incarceration is such a normalised part of their lives, that there is this sense of hopelessness, but at the same time, they don't necessarily see it as hopelessness. They just see it as an expectation, and we've got to change that. That narrative needs to change. On the flip side to that, what we also found was that despite the fact that some of these guys are at risk of dropping out of the education system, and or at risk of incarceration, etc., still extremely intelligent, articulate young men that knew, in many respects, knew right from wrong, had a deep interest in their health and well-being. So really started to challenge those assumptions around them not caring for their health or the health of others, not caring about relationships, not caring about lots of things in life. And it flips that narrative. And I think providing opportunities for those discussions in an open and frank way is really important. There are some examples of work of organisations working with boys and young men of colour across the US. My Brother's Keeper, Making Connections, the work that's happening there, Forward Promise, Campaign for Black Male Achievement, lots of different examples of work that's going on and supporting grassroots community work to work in that space. But to be honest, I would say that most of that I've seen during my time in the US was directed towards African American males, and probably less so Native American males. And so I think that there's a need to understand some of the cultural context that's maybe slightly different for that group. And sorry, the National Compadres Network is another one that's been doing work in that space, and probably spoke around some of the healing work and thinking potentially a little bit more holistically to be able to influence that space. So again, I don't know that I've answered your question per se, but more work in that space is incredibly important.
Yeah, thank you. What was the last organization name?
The National Compadres Network.
Compadres. Okay.
Yeah.
Got it. Thank you.
Not a problem.
I have another question.
Yep.
So much of health promotion is asking young males to look ahead, like career, education, family. What messages are there that can motivate young males to look into their future? So to get preventative health care. Any helpful examples?
Yeah, listen, there's been a few. I'll rephrase, or not rephrase the question, but I'll come at it a slightly different angle. Something that we have heard repeatedly, both with this research project with young males and with older Indigenous males that we've done in the past, has been start young. So even these young males are saying, you know, stuff needs to be happening back when I'm a little kid, back when I'm just entering school, and so forth. So this, we've really got to shift backwards to be able to start earlier in these young lives. At the moment, what we tend to do is we go, oh, they're suddenly engaging in some sort of deviant or risky behaviour. We've got to intervene at that point. What we've actually got to do is go back to those early years and those primary school years to be able to change that narrative at that stage, rather than talking about it at that life juncture where they're starting to engage in those behaviours. So we've got to be sort of one step ahead. So I don't know that that's answered your question, but there's not a huge amount of work happening in that early years or primary school space. We're starting to see examples of that again, but we need to see that documented. We need to see that information and evidence being shared to be able to guide more work in that space. When we've got that evidence, we've got a better ability to have those conversations with the government officials and policymakers around investing in that space. But at the moment, it's sort of off their radar. And unfortunately, that which is funded tends to be a little bit more reactionary. That being said, the evidence is really clear around the need to invest in the early stages in life, and the impacts that can have across the life course, across that life course trajectory. But what works and what doesn't is the evidence that we don't have at the moment within the context of boys and young men of colour.
Thank you. A comment and a question. Thank you so much for this presentation. What are your next steps with this research?
Great question. What we've done, we've been really fortunate in that we've just got a small research grant, a small health promotion grant to be able to take the findings from this research and develop some online modules for health professionals to be able to engage young men in discussion around various aspects of their health. So we're sort of taking the findings that will be developed in consultation with the local communities that we've worked with. And the idea is that the modules will be co-developed with elders and young men. So we want to embed within that developmental process that sort of intergenerational exchange aspect that I mentioned earlier. So we're keen to keep doing more work in this space. Like any research or health service organisation, finding the funding to do that is a real struggle. And we're really fortunate that we're also about to set up a Centre for Male Health and Wellbeing within the research institution that I'm at, which will help have a longer term vision around work in this space as well. It will also mean that I'm better equipped to be able to continue these conversations, not just at the local level, but at a excuse me, at a national and global level as well. So doing partnership work with health service organisations within the US context, where we can have sort of those reciprocal relationships and learn from one another, I think is really important in that regard. But we're certainly doing some work for young Aboriginal males in the top end of the Northern Territory to continue that. And the best way for us to do that, as I mentioned in the presentation, is to work with those organisations that are already working with those young men as well.
Okay, thank you so much. I have some questions of my own, but I wanted to go ahead and give priority to our participants. So are Aboriginal people considered sovereign, like American Indians are considered sovereign tribes in the US or sovereign governments? Are Aboriginals considered sovereign in Australia?
They're considered sovereign, but we don't have any treaties in place. So whether it be work around land rights and land ownership, whether it be around the privileges that they do or don't have about doing work, staying healthy on their country, we don't have some of those mechanisms in place. We do, however, have strong Aboriginal community controlled healthcare system across Australia that has shown, a huge ability to deliver services that are culturally responsive and that meet the needs of Aboriginal and Torres Strait Islander communities. heavily underfunded. It would be great to see those organisations getting a lot more funding than they do to do the important work that they do. And it would also be great to see more of that work happening within a health promotion and prevention space, because they certainly want to do that rather than at the clinical end. But the funding tends to be biased towards the clinical treatment end rather than that health promotion prevention end, and that's a real challenge for those organisations. So sorry, I think I've veered off in a slightly different direction with that question.
That's good. So do they have government to government relations with the Australian government like the tribes here do?
Some, not in the same way, I don't think, as they do in the US. We don't have a we've got the Aboriginal community controlled health system, if you like, and that has a relationship broadly with the Australian government, but we don't have a dedicated Aboriginal and Torres Strait Islander health service in the same way that there's a setup in the US. So I guess there's a long way to go in that regard. We're also quite different in that we've got alongside that Aboriginal community controlled health service system, we've also got a universal healthcare system within the Australian context as well. So the notion of health insurance is less of an issue in Australia than it is within the US context in terms of being able to access healthcare as required. So that's a fairly significant difference as well, I think.
Okay, and just to explain a little bit more, and people who are native, because I'm not, but what you're describing, it seems like health is only one component of which the Aboriginals have with the Australian government. But when in the US they talk about tribes having sovereignty, it means that they are like Australia and the US negotiating, like not only healthcare, but the whole gamut, because tribes saw themselves as being sovereign before Europeans came to the US or to North America and tried to take over. So they are regarded like, health is only one part of it, but in any aspect of government to government relations, federally recognized tribes have sovereign authority. So do you get a little bit better what I'm saying?
Yeah, and I guess that notion of sovereignty is something where there's still a lot of advocacy going in, and some communities have done well in that regard, where they've been able to achieve their sovereignty and sovereign place in a more formal capacity, whether that be around land rights or so forth. But there's others that haven't. We've also had a stolen generation within Australia where people have been taken off their country, have been physically removed and put into other community contexts, which has challenged notions of sovereignty. If people don't know where they've come from or don't have connection to their land or their country, or that information hasn't been passed down because it couldn't be, because they've been forcibly removed from their family and or community context, there are some challenges to overcome in terms of sovereignty in those cases. But having said that, sovereignty is critically important. There are other narratives that are happening that have a sovereignty connotation to them as well. There's a lot of work in the research space around Indigenous data sovereignty at the moment as well, and that's around Indigenous people being involved in all aspects of a research process, right from the get-go, in terms of what's happening, in terms of the collection, in terms of the analysis, and particularly in terms of the knowledge translation at the other side. And so there's these parallel narratives around sovereignty that I think are really important. What I don't think we've done as well as we could do in Australia, although some organisations, the Lewitcher Institute, which funded this research, is a good example, there's a need to think much more holistically around sovereignty. There's a need to acknowledge that those relationships to land, to sea, to country that the interconnectedness between families, between clans and tribes, and the song lines across different community contexts are incredibly important, that everybody's connected. So tying that into the sovereignty story is important, but not something we've done well from a policy perspective within the Australian context.
So you have like different tribes, just like you have here, like in the, okay.
Absolutely, and very, very many Indigenous languages as well. So there's over 600 Indigenous languages in Australia, many at risk at the moment of being lost. At the same time, there's many that are being revitalised as well. So there's a lot of language revitalisation work, but a very long history there in terms of culture and language. And there's also, unfortunately, been a very long history of colonisation that's impacted on that as well. So it's about redressing that and starting to think around decolonising approaches within that context.
Okay. My last question. You said in your presentation that the older men were finding it difficult to connect to the younger men. So what are some of the barriers that you think may be causing that?
Yeah. It's interesting. I think one of the barriers is it's technology. It's around these changes in terms of engaging in different ways. So previously, when a lot of that interaction has been face-to-face, it's been around that direct contact, that's now becoming more obsolete within the lives of these young men, where they're engaging in discussions online through social media and so forth. And that cuts across, or what we found in our research anyway, is that cuts across different socioeconomic strata as well. So young men from low SES backgrounds that you may think don't have the digital literacy and or financial resources to be able to engage in that are engaging in IT. They're finding ways to be able to access that and to stay connected. So I think technology has been a barrier there. But I think it can also be part of the solution. So I think if we go back to notions again around intergenerational exchange of information, how can we support the elders to connect perhaps with technology in ways that they haven't? And how can we get the young men to understand that they've got to think about different ways of connecting and or using that technology to connect with elders in different ways? As well. I also think that just broader society has changed so much very quickly, and we're starting to see that. I think COVID-19 has been really interesting in that regard, to see society's response to being shut down, essentially. So it'll be interesting what that new normal does look like within this context. And whether that provides an opportunity to change some of those narratives around those intergenerational relationships as well. Sorry, I'm being a bit vague there. I don't have the solutions, I don't think, but more work in that space to understand what we can do is really important.
Okay. Thank you. I don't know if anyone else has any questions, and you wanted to ask some questions, so you can go ahead. We have like 10 minutes.
Yeah, listen, I guess the main question I wanted to ask and get a feel from people is whether you feel that what I've presented today does resonate with American Indian contexts, or are there some differences that we haven't discussed today that you think have come up as well? So I'm really interested in feedback in that regard.
Tamara, you can go ahead. She says yes.
Yeah, I absolutely. It was interesting to hear many of the concepts and the comments that you received. Definitely the same themes that came up in many of our discussions from focus groups that we held, and the priorities that had been identified. but I think it's, you know, that would make sense given that many of the environmental conditions and circumstances are very similar, you know, so.
Thank you, Tamara. And to give a shout out to Tamara, I meant to do that earlier, but I forgot with the questions. Tamara was actually in this position that I now hold. She was the person who laid the groundwork for this, making connections in the planning year and stuff like that. So, so thank you, Tamara. She laid a really good foundation. So thank you, Tamara.
Great work.
Yeah. Do you have any other questions? But to answer your question, I do see, like, you know, like Tamara said, the conditions are a lot the same, the whole thing of colonization. So when you were sharing all your information, I was like, wow, this is exactly so much like here in the US with what Native Americans are experiencing and going through. So definitely there's a lot of synergy and a lot of connection. And it's great to hear. Why I wanted you to present is because it's great to hear that, you know, see and hear what's going on in other parts of the world with research, and also to see that, you know, there's common struggles, common challenges, but like research like your team is doing, there's also trying to be a way to reach out and to show the strengths, not just focus on the things that need to be improved, but looking at the strengths of Native communities. So this is really good.
So just on that note, something that I'm very keen to commit to, I guess, is to continue this conversation, to continue sharing stories with Southern Plains Tribal Health Board and other, you know, Native American or American Indian services across the US. Very keen to start to build some international research in this space as well, where we can do similar things and start to test ideas and what works and what doesn't as well. And the reality is that there's very little of that happening at the moment in the space of Indigenous or young Indigenous male health. So that's an opportunity, one that I'm committed to, and I'd love to be able to visit Southern Plains Tribal Health Board at some stage in the not too distant future. I'm determined to get back to the US. You know, I feel like my recent trip was cut short, and it's only grown my passion more to be able to come back and visit some of those places that I have connected to and started to build relationships with. And I say that within the context of this work being very relational. It doesn't, you can't do work like this if you're not prepared to build relationships over time and to invest and sustain them. So I think, if anything, I've learned in the Indigenous health space, that's how important that is. So I just wanted to say a huge thank you for the invitation, for allowing me to present, and let's keep the conversation open. And I'm happy for my contact details to be shared with others. So thank you.
The next question, so you answered it. And just for those of you who are still on the webinar, this is going to be recorded and it will be posted on our website. I'm not sure exactly when, but it will be posted so you can go back and listen to it. And I will stay a few minutes longer for those of you that want to take a photo of Professor James's contact information. You can go ahead and take a picture or write it down, whatever is good, is good for you. But again, Professor Smith, thank you so much. I hope you can get back to sleep.
It's 2:30 in the morning here now, so I'll pop back into bed and see how I go.
Yeah, thank you so much. We really appreciate your presentation, fascinating research, and give our well wishes to the Native community, which you're working with in Australia.
Will do.
Thank you.
Thank you very much. Cheers, Susan. Bye, everybody.
Bye. As I close, I just want to remind you of next week's webinar. It is called Fostering Relational Strengths, the Role of Women in Supporting Men's Health. And that presentation will be by Dr. Judy Chu. Originally, it was supposed to be on Wednesday, the 17th, but due to unexpected circumstances, we had to switch it to Tuesday, June the 16th. So if you're interested in signing up for that webinar, if you haven't already, you can check it out at our website on our trainings page. So we look forward to seeing you again next week, and thank you all for attending and for your participation. Bye-bye.